feel to be up here with my hero. So my name is Dr. Hazel Harper Johns. People know me as Hazel Harper. I am a proud graduate, a double graduate of Howard University. So I graduated from Howard University College of Dentistry with the class of 1975, otherwise known as STB, which is our nickname for Simply the Best. So I'll know that there may be some other classes that may disagree, but we are very, very proud alumni. At this point, before we really get started, and in our Howard way, the only way, I would like to ask Dr. Donna Grant Mills to please come forward and give us an invitation.
Let us bow our heads in prayer. Most gracious Creator, we come before you this morning to just say thank you. We thank you for Howard University College of Dentistry and what this college has meant to this nation and the world. On this morning, we gather in honor of the first annual Oral Health Awareness Day, a day that has been long in the making, and gathered today, we give you thanks for allowing us to speak in one voice, fellowship, and gathered today are our deans, our faculty, our administrators, our alumni, our organization leaders, our professional organization leaders, our industry, our staff, and our students. We thank you, Lord, for those who planned this program to bring it to what it is today. And as we move forward in the program, bless our speakers. May their words enlighten us, and may this program be memorable. We give you thanks for the book that we will celebrate in the second segment of this program, the authors, and all who will be blessed to hear their words. We give you thanks. Amen.
Thank you so much. And now we will have a video greeting welcome from our Howard University president, Dr. Wayne Frederick.
Welcome to the 2022 Oral Health Awareness Day at Howard University. Howard College of Dentistry is the 5th oldest dental school in the nation. Its longevity speaks volumes to the impact it's had not only in the world of dentistry and oral health, but also in overall healthcare in general and in our society at large. The distinguished service of the alumni continues throughout this nation and the world. The College of Dentistry has helped place oral health in the center of healthcare rather than on its periphery. Throughout its 140-year history, the College of Dentistry has worked to combat disparities in oral health, prevention, and access to care across the country and throughout the world. As recently as 2020, Black American dentists made up only 3.3% of all the dentists in the United States, while Black Americans make up about 12.4% of our population today. This challenge is the gauntlet Howard University accepts with temerity, humanity, and grace. The College of Dentistry has evolved from its trailblazing origin in 1881, with its first graduates in the class of 1883 to 1884. The college now graduates approximately 70 African American dentists annually who care for underserved populations nationally and globally. Moreover, the dental faculty continues to educate clinically proficient and culturally competent dental and dental hygiene graduates regardless of their ethnic or racial backgrounds. Howard has cultivated and produced leaders who introduce significant equity and justice within the oral healthcare infrastructure. A patient's oral health can reflect a more general health issue. To bypass dental care or to limit the influence of the Howard University dental, advanced dental, and dental hygiene graduates would be to do a tremendous disservice to the healthcare system and the patients who depend on it for their health and well-being. Such liability is especially true for people from underprivileged communities, often predominantly populated by Black and brown individuals. Many persons struggle to access healthcare in general, and they have limited opportunities to visit the dentist to care for their oral health. Unfortunately, we often see vast disparities in oral health between privileged and under-resourced communities. Notably, the College of Dentistry has been at the forefront of introducing greater gender diversity into the field of dentistry as well. We would be remiss if we did not acknowledge the longevity and leadership of Dr. Russell Dixon, Dr. Joseph Henry, and Dr. Jean Singford, the current Dean Emerita of the College of Dentistry. When Dr. Singford became the Dean of the College of Dentistry in 1975, she was the first woman ever to become Dean of an American dental school. She has been a trailblazer in her field and empowered many to follow in her footsteps, including the current Dean of the College of Dentistry, Dr. Andrea Jackson. So as we work to bring Howard forward and realize the core tenets of our strategic plan, we should recognize how our internal operations are connected to our social activism and work to serve our communities. We should also strive always to improve the resources we have here at Howard, given how significant our actions at the Mecca have proven to be in the world at large. So thank you for participating in Oral Health Awareness Day at Howard University, and I hope you'll continue to recognize that the mouth is a portal to our overall health. Thank you.
So at this point, I really truly would like to acknowledge Dr. Fatima Barnes and her amazing staff. Raise your hand, please, Dr. Barnes, because they have put together and worked tirelessly to bring together this event. I also have a couple of housekeeping things that I need to just go ahead and say right now. There are restrooms on every floor in this library, so those that may need to use them, out that back door and to your left will be the nearest restroom. Also, a buffet lunch will be served at 11:30 right here in this room at the table where you are seated, all right? So you don't have to go anywhere. So the morning program will be totally in this room. And then following lunch, we will take a little short walk to the WHU TV station where the fireside chat will be televised, all right? And that will last about an hour. And then we come back here because for those of you that received the wonderful books that you have, when we finish at the TV station, we return here for a book signing and reception from 2 to 4. So the day is not going to be complete until you get your books autographed. So as Dr. Grant Mills said in her prayer, wonderful prayer, thank you, Donna, this is a day that indeed celebrates and honors the 140th anniversary of the founding of the Howard University College of Dentistry and kicks off June as Oral Health Month. And it also introduces the Undaunted Trailblazers, Minority Women Leaders for Oral Health. So we have a lot of things that we're celebrating today. The purpose of this symposium, for anybody that doesn't already know, is to understand the science base for the expanded role of educational institutions regarding the context of community and social determinants of health. A second purpose is to distinguish leadership scales in new interprofessional models. Thirdly, to identify programs for the early recruitment of students and make sure that we have that pipeline and pathway programs. And finally, to interpret and promote the relationship of oral systemic health and interprofessional education and collaboration as it relates to patient-centered care and health outcomes. I would like to be able to acknowledge the sponsors for today's program, Delta Dental and Colgate, And at this point, I would like to introduce Dr. Karen Horace from Delta Dental, who will share a few words and remarks with us before we actually start the panel. Dr. Horace.
Good morning and thank you. As an alumna of Howard University and a member of Delta Dental of California, I'm so honored to be here today on behalf of Delta Dental and its philanthropic arm, the Delta Dental Community Care Foundation. Delta Dental and its foundation share a common mission of providing greater access to oral health care and helping both the people and the diverse communities that we serve lead healthier lives. For those folks who are not fortunate enough to have access to oral health care, the foundation fills that gap through its investment in partnerships such as the one we have with our friends here at Howard University. I am proud that since 2017, this partnership has enabled the funding of student leadership awards and endowed scholarships to support and bring greater diversity to the next generation of oral health practitioners. And most recently, the foundation has launched an important multi-year program to address the oral health care crisis for senior adults, a significantly underserved population with regard to their oral health needs in this country. I'm proud of the efforts of the foundation and really, really grateful for the opportunity to return to Howard today. I'm a Howard graduate, and while it seems like I left Howard just yesterday, it was actually 30 years ago since I graduated from the College of Dentistry, fresh-faced and eager to serve my community. After leaving Howard, I pursued my specialty training in periodontics, and I've been a practicing periodontist for the last 27 years in a large group practice in the Atlanta metropolitan area. 90% of my patients are Black, and they range socioeconomically from middle class, working class to upper middle class. Unfortunately, despite my presence in my community, I am still only one of 3 to 4% of periodontists in America who are Black. Every day, I see firsthand how the confluence of limited financial resources, the dearth of general and specialty providers of color, and reduced access to care conspire to ravage the Black community with caries, periodontal disease, and tooth loss. You do not need to examine the healthcare system in America for very long to realize that the cost of oral health care impedes access to care for people of all races, and that this is a particular issue for people of color. Recently, I'll share an anecdote, but recently my practice hired a new director of clinical operations whose goal it was to increase our practice productivity, largely by increasing acceptance of implant cases. This is a goal I support. Soon after that, he and I had a wonderful, heartfelt conversation about treatment planning, and he encouraged me to present more of what I would call Cadillac treatment plans, where the cost of treatment can often be $20,000 to $30,000. Now, there's nothing at all wrong with Cadillac treatment plans. In dentistry today, with sinus lifts and implants and bone grafting and implant-supported dentures, treatment plans can easily go beyond this sum. My new colleague acknowledged that he knew that every patient wasn't going to accept this plan, but if only 10% of them did, it would be financially beneficial for me and for the practice. I responded with fondness to this new colleague of mine, and I said that, of course I would love to treat the 10% of patients who could afford and would accept the $30,000 treatment plan. But as we focused on that segment of the market, what was our plan to address the needs of the patients who would not choose or simply could not afford these plans? In other words, who would treat the other 90% of our patients? Consistent with who I am and the mission of service instilled in me at Howard, I simply could not leave that 90% of our population behind. Of course, the challenge of treating my patient population goes far beyond socioeconomics. I understand that I must not care only for my patients' teeth, but for the rest of their bodies and sometimes even their minds. So much of who I am as a provider is about the lessons I learned at Howard, that the patient is more than a set of teeth, that behind the teeth may be a person with uncontrolled diabetes and an A1C score of 10. Behind the teeth may be a person with a kidney transplant and whose medication has caused their gums to overgrow their teeth. There may be a person with hypertension who, despite taking their medication consistently, still has blood pressure that remains elevated. A person whose adult child is struggling with homelessness, a teenager who struggles in school and is on the verge of dropping out. These are some of my patients, and patients bring all of these challenging circumstances with them to the dentist. As their providers, we sit at the intersection of medicine and dentistry, perfectly positioned to collaborate with their physicians or with other community partners to achieve successful medical, dental, and social outcomes. At Delta Dental, we know that the gateway to holistic health can start in the mouth. The more we can do to help people, kids, adults, seniors, regardless of their race or socioeconomic standing, get the oral health care and dental hygiene guidance they need, the healthier lives they can lead. So we appreciate being able to support Howard University College of Dentistry's great work in increasing the pipeline of minority providers, focusing on the collaboration between medical and dental providers, and uplifting the health and wellness of our communities, one person at a time. Thank you for allowing me to be here.
Goodness. I don't know about the rest of you, but I was standing over there getting goosebumps and feeling so enormously proud that this woman has such deep roots to Howard University, and that has been inspired and motivated to carry that message and to be a megaphone for all that we stand for. So I just want to say thank you for leading by that moral compass and having that level of humanitarianism that started right here at Howard University College of Dentistry. So you are really a role model. Thank you for that powerful message. So without further ado, I would love to be able to begin our first panel, which is entitled Diversity and Howard's Mission, Past, Present, and Future. And truly, some of my most favorite people are here. Former leaders of the Howard University College of Dentistry, the incomparable Dr. Gene Sinkford, Dr. Charles Sanders, and Dr. Leo Rouse. So without further ado, ladies and gentlemen, please proceed.
I do have to take that off so I can breathe. Good morning. It's always wonderful to be back at Howard. And Dr. Harper, thank you for that introduction. So I'll lead off with the deans. This panel of living former dental deans, Sinkford 75 to 91, Sanders 95 to 2003, and Rouse 2003 to 2015, represents a 40-year span of dental education in America. We've led a mission-oriented institution to produce Black dentists who would improve the health of racial minorities throughout the country and throughout the world. Our students come from around the world. Howard's College of Dentistry was founded in 1881, as the president has told you, in a country with statistical estimates of, in 1885, showing a total of 15,000 licensed dentists in the United States. And 25 of them, only 25 of them were licensed Black dentists. In fact, we almost had none. Segregation at large left Howard University and Mary Medical College in Nashville, Tennessee, alone to produce Black dental professionals to meet the urgent needs of the Black population. It was not until the Civil Rights Movement, until the 1960s, and we fought very hard, so that there would be significant increase in integrated schools, dental schools in this country. By the year 1900, there were 125 Black dentists registered in the U.S., and today there continues to be a shortage of Black dentists. In fact, there are over 1,900 shortage areas throughout the country, as indicated by the Public Health Service. The mission of education, service, and research has been a part of our 140-year history. The college merits its approval rating among institutions of higher education, that's the Middle States Accreditation Body, and full accreditation from the Commission on Dental Accreditation. Since its programs, since 1948, all of the programs at Howard are fully accredited with no citations. Throughout the years, the sustained growth of the college is evidenced in its facilities that have been renovated and updated continuously. The students and faculty and supporting staff have increased, a large increase over the time when I was a dean, and curriculum objectives have been revised to maintain vitality and relevance to the, especially to the poor and to underserved and the handicapped, or the special patients that we now call them. Howard University is unique in its mission, character of its student body, complexity of its faculty, diversity of its alumni, and the dedication of its supporting staff members. And our outreach programs have a local addressment as well as national and international. Our construction and renovation has been very pertinent to our quality. Throughout the 140-year history of the college, changes in its physical facility have been made to the quality, but to the state-of-the-art equipment, but not only ideas, and expansion of its of the student body, because we've gone from small, like 50 students in a class, as much as 100 students in a class. The construction and renovation through the 140-year history of it has changed the physical facilities, but it's maintained its quality through the state-of-the-art building and also expansion of its academic programs. We've changed the facility as we've changed academic programs. The three-story building that housed the college was occupied in 1955. So that was the building that I inherited. A major construction renovation project for the five-story building was completed in 1981, okay? And the new addition of the fourth and fifth floors to the three-story building included a bridge to the Howard University Hospital and its acute medical and dental facilities. That gave us an opportunity to develop a department of dentistry in the hospital, as well as to use all of the other acute facilities. The dental building was named after Dr. Russell A. Dixon, who served as its dean for 37 years, which is amazing. Deans don't serve that long anymore. The addition of 2 floors allowed for the expansion of student enrollment, advancements in technology, new academic programs, automated record keeping, centralized sterilization for infection control, and we were pioneers in that, control, and the school moved forward with high-speed technology away from the Belcher instruments. It introduced implantology as a multidiscipline because the surgeons, the periodontists, and the general dentists got together to develop our first program in implantology, designed clinical patient treatment modules so that individuals would learn and serve patients in teams, and we added new programs in advanced and general dentistry and expanded the dental hygiene clinic. New heating and air conditioning systems were included in the $8 million project, and all of the academic programs were made fully operational during the 3-year construction period, which was amazing. But we got ready for COVID because we knew that we could switch classes and faculty around so that we could continue to serve the students at all levels. A 20-year strategic plan was adopted in addition to the use of the new facility in converting science, technology, patient care, and the future innovations that we perceived at that time. Those changes were seen gradually implemented. The strategic plan has served as a template for change, progress, innovation, and relevance to the oral health of minority communities throughout the U.S. Now, faculty development, I can speak briefly to faculty development, has been one of our major cornerstones for the quality of academic dentistry. It sustained its commitment to excellence in education through funding for faculty recruitment, retention, and development. Our postgraduate training for the faculty has been supported through the years with trustee scholarships, federal research and training grants, contributions from friends and alumni, and from a major general trustee donor, Dr. Louise C. Ball, which enabled us to establish the Ball Fellowship Program. And that was founded in 1948, can you believe that? And it still exists. Most of our faculty that have advanced degrees have used these funds. LCB fellowships allow the recipient to have a choice in the field that you want to study in and the selection of the place of study. And in quotes from her will, it said, in other universities in the United States and elsewhere. So the recipients of the Ball funds can make a decision as to where they want to study in the U.S. and in the world. LCB fellowships have expanded opportunities for dental and dental hygiene faculty to pursue a variety of specialties such as oral surgery, radiology, oral pathology, fixed and removable prosthodontics, dental material science, pediatric dentistry, public health, dental research, and master's degrees in dental hygiene. The awards require a return to teaching at Howard, however, and upon completion, there's no free lunch, okay? The fellows have contributed to our Grow Your Own philosophy of minority faculty recruitment, retention, advancement, and happiness here at Howard. Okay, Howard is an institution with a proven past, vibrant presence, and a challenging future. Now, I have a couple of slides to show you, and I had to go to the Moreland Spring Garden to get these for you. But I used Dr. Rayford Logan's book, History of Howard, the first 100 years. And if you need to know anything about Howard's development, founding, et cetera, and our relationship with the federal government, et cetera, you can read that in that book. Okay, the slides will show you, at the top, it's the 3-story building, which I inherited, and that's not the new building. The windows represent the new building because in the new building we wanted more outside windows so the clinic spaces would be outside. And then if you look at this one down here, you think that's the 4th and 5th floors there, but it's the very first picture I could find of the school that has the 3 stories, and in the back you see Griffith Stadium, which was an old football stadium, which is where the Howard University Hospital now is. So thank you for this opportunity to speak with you, and enjoy the rest of the day.
Good morning. Good morning. I have the privilege of being here today largely because of Dr. Saintford, who got me involved in administration, sort of twisted my arm and made me take the job as chairman of orthodontics, and then started adding stuff on after that. So I owe Gene a lot. I guess some of the faculty of the college may think otherwise. But when I became dean, President Swaggart and new provost said we had to do something about our attrition rate. We had an attrition rate that was running between 20 and 25%, and with the national average being 3.5 to 4.5%, and we had the AARP program in place. So, but what we had to do to lower that number was raise the GPA and the DAT scores to improve the number of applicants quality of applicants that we were taking into the college. At the same time, trying to increase the pipeline, which continues to be a big challenge. As a new faculty member, travel around the country visiting HBCUs, I would go to high schools in the area and meet with career counselors, and I can honestly tell you I never once met an advisor that could tell me that they ever advised a student to consider a career in dentistry. And so that's our challenge. Dentistry has a wonderful story to tell. We just have to find some good storytellers to get that information out to the community. And we looked at our recruitment committee at the college, and we decided we had to go younger. We felt that the students that we were talking to needed to be able to relate to the recruiter and hope to be like that person. And so those are some of the challenges that we face in the profession. The academic reinforcement program, which started in 1969 at the College of Dentistry, enabled us to bring students in for the summer who did not quite meet our admission criteria. Maybe they were a little off with the GPA scores, or the DAT scores were, one or two of the DAT scores were down. And we bring those students in the summer, put them through an intensive summer program in basic sciences that they would be experiencing in their first year, and introduction to dentistry. And if they were successful in completing that program, then they would be admitted to the college and also followed at that time. But any student, even if they were not a ARP admission, could participate in our tutorial programs and remediation programs that we established to assist these students to make sure that they are successful in dental school. That program has had just over 500 students who have successfully completed the College of Dentistry, and it needed to be expanded on and through the grants of Robert Wood Johnson Foundation, and we were able to bring in students, undergraduate students in their second and third year to the College of Dentistry and allow them to shadow students in the clinics, in the laboratories, and in the classrooms, and we give them some instructions into how to prepare for the admission process into the college. This was, again, trying to reach out to get students to come and consider careers in dentistry. One of the challenges I had was that we had absolutely $0 scholarships for freshman dental students. And so I went to the president and told him we were losing out on talented students who applied to the college, were accepted to the college, but majority institutions were outbidding us because I had no scholarships for freshman dental students. We had trustee scholarships for sophomore, junior, and senior students. And so I asked the president for 20 scholarships, and we got 10. And my naivete, I should have asked for 30, and maybe I would have gotten 15. But I didn't know any better at the time. But those scholarships were very helpful in allowing us to hold on to some of the better students who had applied to the college, and we keep here at Howard. I remember really highly pursuing two twin students. I think they're pediatric dentists now, from Southern University. And they were heavily recruited at majority institutions. And we brought them up here to visit the campus. This building was just being completed. And we had Mrs. Bynum, who worked at the college, picked them up at the airport and took them to B. I met them at B. Smith's for lunch, and they had never seen a black-owned restaurant that size coming from Baton Rouge. And spent a couple of days on campus, and then we took the subway over to Pentagon City, to the mall. And they were very impressed with that. So the president wanted to know what was it that convinced them to come to Howard. And I wasn't quite sure if the new Stokes Library, B. Smith's, or Pentagon City. But that was a success story. But we've had many of those. But this outreach as we try to recruit students to come to Howard. What I try to remind them, there's a difference between being at the country club and being a club member at the country club. And when you come to Howard University, nobody's going to question your intelligence. Nobody's going to wonder whether you were an affirmative action admission. You're going to be accepted for who you are. And we expect the students to excel. Don't let your IQ determine where you finish, but what's to determine where you finish is what's inside of you and how hard you work. And we have to motivate them, mentor them, and try to inspire them to be the best that they can be. And this is what Howard University College should be all about. I would encourage, we also had a alumni recruiters program, which I think Dr. Sinkler started at the college. And we had about 25 or 30 dentists around the country actively participate in going out to local colleges in the area and talk about a career in dentistry. And that was quite helpful as well. When we get calls from some of those graduates who will tell us about certain students, and we would contact them and get them interested in coming to Howard University. The challenge is to expand the pool, and that's something that we as a community, African American community, we have to work on, and also let the story be told about the tremendous opportunities that the career in dentistry have. I tell students, you know, as a dentist, you will never, ever miss a holiday meal with your family because you're on call, or be up all night at the hospital. Maybe Dana has missed a few, I don't know. But most of us won't run into those kinds of problems. And dentistry has been so good to me and my family, and I think that if we continue to inspire young people, let them know what opportunities are available, all the various careers that they can pursue in dentistry, they will consider it, because I have a daughter who is a physician, and I can tell you, and she'll tell you herself, that she works a lot harder than her own dentist and makes less money. And that's a story that we can put out there and be truthful about. And the quality of life is very, very good. Very, very good. I diverted a little bit from my prepared notes, which I'm prone to do. But recruitment is the key. And inspiring students, encouraging students to be the best that they can be is something that I enjoy doing. I wish I was still in teaching. I miss teaching. I never missed administration for one day. But I thoroughly miss interacting with students and growing with them as you try to expand their knowledge base in the clinics. So I will just end with that and let you answer any questions later on as we proceed.
Yes, ma'am. Oh, boy. It feels good to be back home. It really feels good. This is homecoming for me. I want to welcome again Drs. Sheila Price and Dr. Brown Loper. I can tell you a few war stories, which I am prone to do most of the time. wow, I look at this group here, those you work with me, and et cetera. It's just been fantastic. So, you know, when Dr. Saintford calls you and says there's a mission, it's like E.F. Hutton's calling you, and you just kind of stop and you take the ear over and you listen. When Charles Sanders calls you, he said, Leo, I need someone to come serve in my clinics. So in 1995, Dean Sanders started recruiting me. I was having a good time, and so was South Korea. Really enjoying myself. And I mean, Buddy literally called me almost every other week, every other month, until when I came to town, he knew I was in the city on a mission. I have no idea who told him I was here. But I thank my predecessor for the opportunity to serve as his clinical dean, and then finally I became the dean of the dental school. This young lady to my left was associate dean when I was a freshman in 1969. So I finished undergrad at Howard in 69, and I also finished dental school at Howard in 73. My dean at the time was Dean Joseph L. Henry, and when I was in military, he was at Harvard. And I brought him down to my command in Fort Devens just to talk to my troops about perio. He said, what's your plan when you get out of the military? And I just kind of laughed and said, I want your job. So here I am as a dean, and I thank Dean Sanders because Buddy really put the old push on me. He said, you will come and serve as my clinical dean. Ladies and gentlemen, this is truly a blessing and an honor to be here today with you. And Dean Saintford asked me to talk about 3 different areas, and my passion today, as Dr. Grant Mills knows, is IPE, in professional education and collaborative practice. I'm going to talk about 2 programs that basically are still in existence today at Howard. The first program is the Chronically Ill and Aged program. I don't see Romello out there anywhere, but I know. Hi, Romello, good to see you. Romello still runs that program. She runs it very well. So in 1962, the CIAP program, or the Chronic Ill and Aged program, was started. And the program today is still consistent with CODA standard. CODA is the Commission on Dental Accreditation, 2-25, which means that graduates must be competent in assessing and managing the treatment of patients with special needs. As defined by the college, these individuals may include, but are not limited to, people with developmental disability, cognitive impairment, complex medical problems, significant physical limitations, and the vulnerable elderly. Howard University is a leader in this program, which I experienced as a pre-doctoral student during my time at Howard University. And today I still want to tell Romello how well she has done in managing that program. We were far ahead of other institutions, other dental schools. And today, as we speak today, there are schools that are fabricating and putting together clinics just for special needs impaired patients and the elderly. And I do hope that Dean Jackson, when we build a new school, which will be a stone throw from here, that we include a special needs clinic just for special needs patients. I'm very proud of the program, which I experienced when I was a student here at Howard. And it's just wonderful that we take care of those who have limited access to oral health care. And today, as we talk about these programs, I'm on 2 boards of visitors. The Board of Visitors of the University of Pittsburgh and Meharry. I was on Tufts Board until 2 years ago. And each of those schools are beginning to start. I sit there and they say, oh, I know what you're talking about. We've been there and done that. That's what Howard does. Leaders. So in 1970, I know Hazel remembers this, and most of you do, and Buddy does, we began the Dental Auxiliary Utilization Program, or DAUP. Learn how to do four-handed dentistry. The objective was to really improve productivity, but at the same time, he wanted to take those talented young men and women, our students, to recognize the importance of how to keep good posture. And that's probably my problem right now, Dean, and I didn't pay much attention to DAU. Just so those with this little lamp, thank you, Sheila. I just had back surgery 3 months ago, colleagues. So it was a long procedure, but I'm okay. And I would not miss this program today because it's so important to me that I be here. However, I do know programs to minimize the risk factors that we as dentists experience chairside or in the OR. We need to incorporate also the physical therapists and the occupational therapists in those programs. And so I know the efforts being made. So now my passion. So in 2008, I had the blessing and the fortune to represent ADEA, the American Dental Education Association, on a panel, an expert panel, to develop the core competencies for IPE, or interprofessional education. Oh, that was a hoot. Nothing more joyous to sit down with a bunch of physicians, allopathic and osteopathic, and listen to them try to figure out who's going to be in charge. And being a young dean as I was at the time, I said, well, let's make it very clear. It doesn't matter whether it's a nurse practitioner, a PA, a veterinarian, or your local pharmacist. Maddie Smith, a PhD nurse practitioner from Rochester, chaired that committee. And we had the challenge to develop the core competencies, values, and ethics, roles and responsibility, regardless of who's in charge. Interprofessional communication. How do we relate to each other? I still remember Dr. Bird, who was the director of CMS, and he was going around various hospitals around the country, and he told a story when he spoke to the panel. I spoke to a young man who had just had surgery in one of our very specialized hospitals for children. And I asked the young man upon his discharge, what could we have done to make your experience at your hospital stay better? A 13-year-old said, I just wish you all learned how to talk to each other and share information. There we go with the triple aim. How do we improve access, health equity? How do we improve conversation between physicians, nurses, veterinarians? I had to challenge Dr. Barnes to speak to the academic health sciences librarians back in 2016. And they were the last group at your association to really become partners with the IPEC. And I was asked the question, why us? They said, who else will be able to tell the story about IPE than academic health science librarians, those directors? And it was fun. So, CODA standard now, 2-20. CODA standard, again, CODA is Commission on Dental Accreditation, 2-20. Graduates must be competent in communication and collaborating with other members of the health care team to facilitate the provision of health care. And thank you, Karen, for what you're doing in Atlanta. You spoke about IPE, you talked about person-centered health care. One of my missions today is, even though I'm retired, I'm still actively engaged, is to push the envelope on primary care integrated with oral health care. That's my goal. And I'm having a good time doing that. So right now, the IPEC, or the Interprofessional Education Collaborative, in 2016, took those 4 2008 and 9 core competencies and made them one. And that's where IPEC came from. In Professional Education Collaborative. That encompasses all 4 of those values. So, the IPEC works diligently. And to the students who are here and residents who are here and the faculty, you must communicate, and I do what I like to call the 2 C's. I communicate well, but I love to collaborate. Love to find partners. That's important. And I can tell you that in West Virginia, where Dr. Price is located, and in Michigan, from where Dr. Woolfolk retired, they're all into it. And so when I left the dental school in 2015 to go down to Adair to become even further mentored by my second mom, Dean Emeritus Sinkford, we had a blast for 4 or 5 years. And I left the challenge of IPEC to Dr. Donna Grant-Mills. And Donna's done a fantastic job integrating the university, along with Dean Jackson, the other deans, to be more collaborative and to make this work. And so my dream for Howard is to establish an IPE center. And I told Donna, if it happens, I will call Wayne Frederick. We call him Freddie. And I will say, Wayne, make Donna the director of that program. It's important that we have that. Person-centered care is so important. Health and equity, we learned so much in the last 2 years about the pandemic. We learned a lot about what has happened to the whole health equity piece and the health equality piece. And so I really encourage you, if you are not up to speed on IPEC, there's going to be a big conference, by the way, down, this month rather, in Atlanta, in 3 or 4 days. Unfortunately, I can't fly just yet. I would have been there to just talk the talk, to walk the walk. And I know Dr. Harper has been very involved with nurse practitioners of the Great New York meeting. I thank you, Hazel, all you've done in that area. It's important. Here at Howard, we need to have this IPEC center with a director, and let's take it seriously as we build the new academic health science campus. It's so important. And no need for us to be behind the 8 ball. We're moving forward. And I thank you again, Donna, and I thank you, Hazel, what you're doing. It's important for the students. Learn how to understand what your colleagues are doing in pharmacy, nursing, medicine, divinity, communications, law. It is so important that we get this right. We learned so much over the last 24, 25 months now about health inequality. I'm going to tell you one quick story, then I'll sit down, Gene. I got it, Hazel. Susan Moore, Dr. Susan Moore, an African-American physician, December 7th, 2021. Look her up and hear her story. Thank you very much.
Let's give our Dean panel another round of applause. These were the real movers and the shakers, and as you know, I just did not have the heart to stand up, and out of reverence and deep respect for who they are and how much they've done for Howard University, I think they deserved a few extra minutes. So thank you, deans, thank you. So that only puts more pressure on those that come behind. So on the current Dean Jackson, please come forward with Dr. Greenfield and Mr. Richard Myers, and just know that we'd love to be able to keep all of your sessions to at least 12 minutes. Everybody get a timer, and I'll be your timer this time. I will stand up at the end of 12 minutes, because if we're trying to have any kind of Q&A at the very end, even if we're trying to get to lunch on time, we got to try and stay on schedule. Okay, so thank you very much. And joining us here up front are Dr. Dean Andrea Jackson, Dr. Tanya Greenfield, Director of Operations and Strategies for Howard College of Dentistry, and Mr. Richard Myers, the former president of the supporting staff organization at the dental school.
The opening day for Oral Health Awareness Month, perfect timing. I am so honored to be here and to have all of our wonderful guests. First of all, the three that were right here responsible for me being here. Dr. Sinkford was my dean. Dr. Sanders appointed me as chair the first time I became in administration, and Dr. Rouse appointed me as a clinical dean. So I owe most of my career to them, and talk to them often. When they call, I respond. That's just how it is. We respect, we hold them in such high and great esteem around here, and they are Howard, and so we so thankful that they're able to join us. Also, we have some esteemed guests. We've talked to Dr. Price and Dr. Woolfolk. We have Dr. Cuffey from Robert T. Freeman and Dr. Cheryl Lee from the NDA president. I'm happy to have her here this morning. And hopefully everyone else, faculty, staff, students, welcome. And we have some staff we'd like to honor. Mr. Richard Myers, he'll give you a couple words. He kind of spurred on this program. So thank you all for being here. I'm just going to give you a brief update on what we do now and where we're going in the future. Okay, so I'm going to talk about enrollment, international dental program, what the graduates look like in the class of 2022, what our clinical boards look like a little bit, introduction of digital curriculum is what we're doing, completion of the Marwa Clinic, community outreach programs, the Center of Excellence for Oral Health, and the Superior Oral Health Coalition. And so just to talk about the International Dental Program, for instance, we started that probably about 2010, and the students are graduates from international graduates, mostly from India. We found our applicants are from there, and they have to come in with a passing Part 1, Part 2 of the national boards, and take a TOEFL exam, and we also look at their GPAs, and they're admitted into the summer prior to the third year, and go through a summer calibration session, and then join the third year class and matriculate with that class to graduate with their DDS. That's been a very successful program over the years. And we can admit up to about 10 students. We usually round out our class size to about 75 or more when they come in and join us. Our freshman class, you can see probably back when earlier in dental school, you can see in Dr. Sinkford's class, there weren't that many women. Well, now we have in our current class of 2025, about 63% women, and 37% men. So that is a difference, how things have changed. And this is our demographic, looking at, we have a predominantly class of about 72% African American, and we do have a very diverse dental school. We're very proud of that. We welcome the other mixture of cultures and ethnicities, and do very well. Our students work together very well, and it helps them to relate to different cultures. Our GPA requirement is 2.85, both cumulative GPA as well as science GPA. And this class was a little above that, where we have a 3.22 overall GPA, and the DAT score is still around 18 is what we accept. Looking at our graduates this year, we had 76 of those who answered the survey. About 29 of those are going to GPR programs or AEGD, and then we have a few going to specialties So about 57% of them are pursuing postdoctoral training when they leave. We also have a few going into DSOs and private practice. And then the boards that we all took, or many of us took many years ago, where we